I also question Miss Hubert, the spokesperson for the St. Francis Hospital.
It's coming here every day,
Mm-hmm.
and some in all kinds of conditions.
Mm-hmm.
Surely one can intuitively and based on their practical experience in the medical community be able to discern whether or not someone in fact did this kind of thing to themselves or not.
I think that I have, because my role is to be the spokesperson for the hospital and to try to stay within the facts as I know them, only in the areas of this case that even pertain to the hospital. I've tried to remain separate from it in terms of forming my own opinions or speculating in any way, because I don't think that that would be appropriate. It's a very bizarre situation, there's no question about it, and I think that in my mind what I always try to do is come back to some sort of concern and compassion for Tawana. We have a young woman who was 15 years old at the time, and obviously everyone thought that there was that there was a certain that something certainly had happened, that she was in a very unusual and traumatized condition. And I think it's important to maintain an open mind about what happened to her. I have no way of knowing what happened.
Okay. But you, again, she was in a traumatized condition.
I certainly don't think that anyone has ever doubted. I think all along when I've talked to reporters, and there have certainly been many, there's been such a tremendous interest in this case over the months. I think that everyone has agreed over the months that something terrible, no matter what it was, did happen. And no matter what the cause or who was responsible, we would all want to know what had happened. And at the bottom of it is a young woman who was hurt in the situation. You know, I think it's important to remember sometimes it seems as if Tawana herself gets lost in all of this, and people stop thinking about her, that it becomes very clinical or very separate from the actual situation. And in our role as the people responsible to take care of our patients, it's important that we try to remember that something happened.
Right. And you're right. Ms. Hubert, in our previous interview, you stated that Ms. Pina, I believe, Dr. Pina, had concluded that there was a possibility of a sexual assault here. Am I correct?
Yes, that had been indicated as part of the diagnosis, and it was that portion of the diagnosis that allowed for the for conducting of the rape examination.
Okay, now, as you very well know, that the Attorney General, or rather the prosecutor in this case, who happens to be the Attorney General of the state of New York, Mr. Abrams, has rendered a final report, and in his report he's concluded that there's no evidence that she was sexually assaulted, and and has also concluded that she did this to herself. Now, we have interviewed you in the past, as I stated just a second ago, and in that interview I asked you, had you ever had a situation such as this where someone had done this kind of damage to themselves? And I do recall you stating that never had you encountered this kind of situation where someone allegedly did this to themselves, correct?
Right. In my experience, I had never seen anything like that. And I, haven't since, of course.